Assalamu alaikum. My name is Dr. Ayesha Waheed. I am a dermatologist and aesthetic physician. Today I will discuss an exciting topic which is GLP-1 agonist, which is considered breakthrough in the management of obesity and being overweight. Obesity and overweight are health concerns all over the world, and GLP-1 agonists have been exciting and innovative drugs for the treatment of obesity and being overweight. So, what are GLP-1 agonists? How do they work? How do they help in the management of obesity? What are the adverse effects, and what are the contraindications? I'm going to briefly touch this topic. So, these drugs were initially introduced for the management of type 2 diabetes, and it was seen that it not only helps manage diabetes, but they also help to suppress appetite. They increases the gastric emptying time, and they helped the patient to regulate weight. So later, some of the drugs were approved by FDA for the management of weight. So different GLP-1 agonists are available in the market. Some of them are approved for weight management and some for diabetes. Saxenda, which has got the drug liraglutide, is approved for the management of weight. Ozempic has semaglutide. It is used for type 2 diabetes, but off-label it is also widely used for weight management. Then we have Wegovy, which also has semaglutide, and it is approved for weight management. Then we have other drugs as well, other brands available. Some are used for off-label for obesity. So, who is an ideal candidate? Somebody who needs to shed a few pounds or kgs is not an ideal candidate. According to FDA, somebody who has a BMI more than 30, that is obese, or somebody with a BMI more than 25 with comorbid conditions like cardiac illness or hypertension is the one who should be given these GLP-1 agonists. Then before starting the drug, you need to take a complete history of the patient, because in animal model studies, it has shown to slightly increase the risk of medullary carcinoma of the thyroid. So somebody who has personal or family history of medullary carcinoma of the thyroid, patients with personal or family history of MEN2 syndrome are the ones who should not be given this drug. Somebody who has history of pancreatitis and other serious GI illnesses should also not be offered this drug for weight loss. Similarly, you need to take a complete history before starting these medications. These are injectable medications. Saxenda, the common popular brand which is FDA approved, comes in the form of pen, and this is given as a daily injectable pen. This comes with a disposable needle, which you need to fix the needle every day, and you give it in the form of a daily injection of Saxenda. Ozempic is used off-label. The dose of Ozempic is weekly. Ozempic is basically semaglutide, and it is used off-label for management of weight. Now this Saxenda, which is liraglutide, you start the dose with 0.6 milligram every day, and after 1 week we will gradually increase the dose. So first week the dose is 0.6 milligram daily. After 1 week the dosage is 1.2 milligram every day. Then in the third week the dosage is 2.4 milligram every day. Then in the fourth week, the dosage is 3 milligram every day. So from zero point 0.6 to 3 milligram we escalate. So doubling the dose every week, starting with 0.6 milligram, then it is 1.2 milligram, then it is 1.8 milligram, then it is 2.4 milligram, and in the fifth week it is 3 milligram. This is the usual common dosage which is used, and if the patient is having adverse effects, this can be further slowed down if the patient is having adverse effects. Otherwise, this is the usual dosage that I just said. The common side effects encountered are nausea. The patient can have diarrhea or constipation. There is increased risk of gallstones. The patient can have gastroparesis, and patient who have severe kidney or liver diseases should not be offered this drug. Generally speaking, it is safe in patients who have cardiac illnesses or hypertension, but it should not be given before consultation with their concerned physicians. In diabetics, it can be used for weight management, but whatever anti-diabetic drug they are taken, the dose needs to be adjusted before adding the GLP-1 agonist. So when a patient comes to you and you are prescribing him or her with the Saxenda, you need to note down the weight of the patient, calculate his or her BMI. You need to tell the patient about the common side effects, the common ones being nausea, vomiting or diarrhea, abdominal pain. And you need to tell the patient that the side effects will gradually go away in a few weeks. So in the first few days, you will ask the patient to take small meals, frequent meals, not to take oily things which can further aggravate the nausea. To combat nausea, the patient can take fruits and small quantity of meals. These things will combat the nausea, and things which will cause nauseating feelings, those foods should be avoided, and slowly and gradually the feeling of nausea will significantly decrease. And the dosage which I mentioned, that is, there's no hard and fast rule to use this specific dose. If the patient is having side effects, the dose can be decreased further slowly. So once the patient has reached the maximum dose of 3 milligram, the 3 milligram daily is continued. So if the patient is taking the dosage which I just said, how many pens will be used? So the first pen will last around 17 days, which is 2.5 weeks. And when the patient will reach the dosage of 3 milligram, then the pen will last 6 days. So once the patient will reach the dose of 3 milligram, he or she will require 5 pens in 1 month. From where is this Saxenda available? Novo Nordisk is marketing it in Pakistan, and from all the major cities the patient can get from them, and they are also available from different vendors, but be careful, there are many fake products also available in the market. And for how long patient can take Saxenda, it can safely be taken for a long time, for 6 months, 1 year, 2 years. It can be taken under supervision for a long time. Then what happens when the patient stops taking Saxenda? Will the weight come back? The weight will not come back on its own until and unless the patient comes back to the previous old eating habits or overeats. So if the patient maintains the weight with a good diet and a good healthy lifestyle, the weight is not going to come back. Ozempic is also taken by many off-label. It is given once a week similar the same way as a subcutaneous pen, similar to Saxenda. Saxenda has liraglutide, Ozempic has semaglutide. Ozempic has a longer half-life, so it is given for once a week. So if somebody is having side effects with Ozempic, so one has to wait for one whole week to decrease or adjust the dose. So it's always better to give Saxenda. Ozempic started at 0.25 milligram, given at once a week, and after 4 weeks the dose is increased to 0.5 milligram, then after another 4 weeks to 0.75 milligram, and then 1 milligram after another 4 weeks, if the patient is tolerating well. And all this needs to be taken under the supervision of the physician of the patient. The patient will not go and get it himself from some pharmacy or somewhere. And this will not be, this is not available at any pharmacy, as this is a prescription only drug. So overall management of obesity and being overweight is a lifestyle modification. Even with this drug, the patient needs to take less calories. What this drug does is that they suppress the appetite, they slow the gastric emptying, so the patient will have a feeling of satiety, the patient will not feel hungry, so as a result the patient will eat less. So this drug basically helps them to maintain eating less and to stick to their dietary restriction. So the patient has to eat less, the patient has to follow a good lifestyle. If the patient is not going to follow a good lifestyle, and if the patient will keep on eating junk food and high caloric food, they will not lose weight, whether they are taking Saxenda, Ozempic or anything else. So this drug will help them stick to their good dietary habits for a long time. And once they leave this drug, they have to stick to a healthy lifestyle. Otherwise, the weight will come back. So they can safely take this drug, provided it is supervised, provided they are healthy adults, and provided they maintain a healthy lifestyle. It can safely be taken, keeping in mind the side effects and following a healthy lifestyle. So there are other brands also available, other drug categories also available, but Saxenda, which is liraglutide, and Ozempic, which is semaglutide, are the common ones available in Pakistan. So the factors which I said need to be considered. Otherwise, obesity is a chronic condition, and a changed, healthy lifestyle is the key to maintain weight. Thank you.